I'm Jack Fortner, Chairman of the San Juan County Commission. I want to welcome you today and our guest, Jeff Bourgeois from San Juan Regional Medical Center.
Thank you, Jack.
Thank you, Jeff. And also joining us virtually is Farmington Mayor Nate Duquette. Thank you for being here, mate. Thanks to both of you for joining us. This week is National Nurses Week. I hope you have taken a moment to think about all of the medical personnel at our hospital and at hospitals around the world. Thank them if you can. We're so lucky to have people who are called to serve others in this way. To our nurses, doctors, other medical personnel, and anyone working in a hospital, be strong, stay safe, and most of all, want to thank you for what you do. For the rest of us, there are still many restrictions in place, but we can't let our guard down. The state has released a list of what's being called COVID-safe practices, and that includes wearing masks when we're in public and wearing masks for all workers, staying 6 feet away from other people as much as possible, and good hand washing. We've got to continue the hand washing. If we're already making these habits a regular thing, then we'll be ahead of the game when it's time to reopen our economy. We are ready to open our economy. This is a tough time. Emotions are raw and patience is thin. Remember that kindness goes a long way, and we need it now more than ever. Check on your friends, check on your neighbors. Together, we can win this by staying apart. I'd like to start out and get the latest from San Juan Regional Medical Center and ask Jeff Bourgeois to speak.
Thank you, Jack. Well, hello, everyone. Just start off with a few reminders. First of all, if you are concerned about your symptoms and or feel you've been exposed to COVID, several easy reminders. First, if you have a primary care physician, call their office and seek their guidance for further direction. As a reminder, San Juan Regional Medical Center has a screening line, 505-675-4722. The State Department of Health also has a screening line at 800-600-3453. And finally, if you feel that you have any COVID-related symptoms and want to come to the emergency department to be evaluated, please call in advance, and please call 609-2901. That way we can be aware that you're coming and be prepared to help protect yourselves and the rest of the caregivers and patients within the emergency department. Some updates from what we're seeing around the state is that the effective rate of transmission has really plateaued. There's been no significant improvement from last week to this week. More importantly, when you look at the effective rates of transmission at a county level, unfortunately now, San Juan County has the highest effective rate of community transmission in the state. On this chart, we're that kind of teal-colored line, if you will. On the right-hand side of the graph, it's the one with the highest data point. In the middle, you'll note that dark blue line, that's Bernalillo County. What's important to note there is that it's had a slight uptick from last week to this week. That means the state's most populous county has now begun to see a growth rate in its effective rate of transmission, particularly concerning for all of us as we watch the spread of this disease throughout our state. Something I want to make sure everyone really takes to heart and hears today in reference to the comments Jack made around social distancing, wearing a mask, and hand hygiene. There's emerging evidence now that tells us, in contrast to the flu, where the highest level of viral shedding, meaning the times when the individual is most contagious, occurs after symptoms are visible. However, in this disease, the viral load in shedding, i.e. when you are most contagious, is most pronounced in the days prior to the onset of any COVID-related symptoms. So given this probability, which has been demonstrated in observed clusters right here in our own community by people eating lunch together, with friends, or at a birthday party where they're unprotected and within 6 feet, and then later coming up positive after one of their contacts who was asymptomatic was shedding a virus. It is essential practice that physical distancing, wearing a mask, and everything that Jack mentioned already. The number of cases in our state and our county continue to grow. Right now, there are 4,493 positive cases in the state of New Mexico. That's 5% of all the tests that have been completed. In San Juan County, there are now 921 positive cases, or 16.2% of the total 5,695 cases that have been completed. This next chart is pretty illustrative of the modeling scenarios that the state is building together. Focus again on that center column of numbers. That's the model that our experience as a state is most closely tracking. So you can see between May 3rd and May 10th, there's a range of 3,850 to 4,786 predicted cases. And as the state updated their website last night on April 7th again, we had 4,493 cases. So essentially right on track to what this model is predicting. If you look at the state region by region, you'll see that the Northwest region, that's the dark red line, way above any other line on this chart, is well above any other region in the state. There's a lot of selection bias in terms of which populations are being tested, i.e. only high-risk populations for the most part being tested, but that's generally consistent across the state. So what we all need to be aware of is that very high rate of percentage or percent positive test in the Northwest region. If you look at the next slide, these bar charts show where we've gone from week to week. McKinley County and San Juan County are on the far left sides, and both counties have seen an increase in the percent positives over all of the tests completed. Very concerning, and you see the state has stayed flat at right about 5%. Again, on the next slide, picking up a chart from last week's presentation, the Northwest region, which again is San Juan, McKinley, and Cibola counties, still have by far the highest hospitalization rate per 100,000 people. So what that is telling us is that the residents within these counties who actually get infected are more likely to need a hospital stay than in other parts of the state. Looking at what's going on at the hospital today, we have 113 total inpatients. We continue to bring new lives into the world. We continue to do emergent surgeries and routine care. However, 30 of those 113 patients are COVID positive patients. We have one patient who's pending a result. We have a total of 8 intubated patients, 7 of which are COVID patients. And some encouraging news. We've now treated or admitted, with those 30 we have in-house, a total of 154 patients. 93 of them we've been able to discharge alive. So sometime, Jack and Nate, I predict over the course of this weekend we will discharge our 100th COVID positive patient and send them home. So we're excited about those successes. However, we have seen 31 deaths in our facility. This virus, when it attacks people, those 20% who have it are at risk for really getting a hospitalization, we're seeing really have a tough course of illness. The next just shows the trend data at our hospital, and I'll focus, if you would, on the green line there. That's really the positive inpatient cases we have at the hospital. It's been relatively flat this week. It's fluctuated from 28 to 33 patients on any given day. So not a lot of change from the beginning of the week to the end, but we are seeing a steady demand of right around 30 inpatients. So in summary, we have a continued high growth rate and high rate of hospitalizations in San Juan County. Again, we have the highest effective growth rate of any county in the state. I know that's not news any of us want to hear, but it is our reality. And for all the concerns about the model, what I can tell you, it's consistent across the state. The selection bias that's in there is generally the same across the state. So our rate of growth is truly higher than anyone else, any other county in the state. Again, the emerging evidence shows people are most contagious in their pre-symptomatic phase. So please, take the advice that everyone is giving all of us. Wear a mask, wash your hands, keep your distance, and protect yourself, and most importantly, protect those around you. So Nate and Jack, thank you, and I'll pass it back to you, Jack.
Thank you, Jeff. Now we'll go to Mayor Nate Duquette, who is standing by from home. Mr. Mayor.
Good morning, Jack. Good morning, Jeff. Thank you all for, again, bringing me on board for this kind of stakeholder update for everybody here in San Juan County. I appreciate the opportunity. I want to start out this morning just with a couple of things. There's been questions regarding traffic counts and things that are happening in Gallup. Obviously, the governor has extended the lockdown order for Gallup, and we believe that'll probably continue multiple times. Obviously, the mayor there has to ask for that continuation. We've been paying attention to the traffic counts. People have asked about the influx of traffic coming in. I think obviously we've seen quite a bit more traffic during normal weekdays. And actually, I shouldn't even say normal. Let's say COVID weekdays since the Navajo Nation put the curfew in. But this past weekend, which was a first weekend of the month, which normally we see about a 20% increase in traffic. Based on our traffic data at 30th and Main Street, which kind of gives us, good perspective of west and eastbound traffic there in the shopping corridor. It was only up 7.3% from the prior weekend. So we've seen traffic kind of creep up throughout the weekdays, but weekend traffic is actually even lower than what we're seeing on weekdays. So I just wanted to make sure I kind of brought that up for people to know. This week, we had opportunities to speak with the Navajo Nation president and the delegates, including the Speaker of the House for the Navajo Nation. Had some great conversations about working together here in a regional partnership and making sure we're staying up to date with things that are going on and finding ways that we can serve others. And I have a great celebration. We were able to put together a kind of a faith-based cleaning supply, and toiletries drive at 7 local churches this week. So Grace Baptist Church, Oasis Church, Calvary Chapel, First Presbyterian Church, Day 3 Church, Sacred Heart Catholic Church, all got with their congregations, and we managed to take out to Bethel Church in Shiprock and Upper Fruitland about 2 tons of cleaning supplies and toiletries. So I think that's a huge celebration for our community and continues to show our ability to come together in support of our neighbors in their time of need. And there's a lot of need out there right now. Please make sure, if you're looking for opportunities of how you can help local organizations, you go to the City of Farmington's website. On there, we have our listing of what the charities are looking for. You can call the Want to Help line at 566-4210 to get that information over the phone. But we know that Echo Food Bank is in need of volunteers, obviously in need of food donations. PATH is looking for masks and gloves and hand sanitizer, paper bags, bottled water, juice, snack-sized food. Frontline Mission, who provides meals, is also looking for funding. The Basin Good Neighbor Fund is looking for volunteers. Salvation Army and American Red Cross, they also need volunteers. Northwest New Mexico Seniors is looking for donations for toiletries for our seniors who are at home. And I certainly think for those individuals who are in a compromised health situation, we want to make sure that we're finding out what they need. And if you know people that are in that area, make sure you're taking care of them and providing support as you can. We continue to advocate with the governor's office on a daily basis sometimes in regards to the safe opening of local businesses. I think it's critical that we continue to talk about what that is. And I have to bring this up today because it's important to me that, in a community that has really done the call to action to put civility first in our actions, to make sure that we're treating people with respect. There's a lot of opinions about our situation that we're in right now, and they're coming from all sides. And whereas in the community, I see a lot of selfless acts of individuals really committing to serving others, what I'm seeing online and in the social media world is really concerning. Look, we get new information every day. This thing is very fluid. What we hear one day may contradict what we've heard the day before. Clearly, what we're showing here is the virus obviously has a high contagion rate. It spreads quickly. We're trying to work and find ways that we can can mitigate that through what Jack and Jeff has talked about in regards to social distancing and washing our hands. But there's a component of that community health component, that comprehensive health, physical, mental, and economic, that we have to keep in the forefront of these conversations. So I'm continuing to advocate for the safe opening. And obviously this is at the governor's choice of when this is going to happen. But in the meantime, what we're doing online and social media, arguing with one another about this point is more important than this point. I don't know if it's doing a whole lot of benefit or positive good for the efforts of us coming together in the midst of a crisis. So I just simply ask my community to consider those things right now. It's Mother's Day weekend. You know, I got my picture of my mom here with me. It's Mother's Day weekend, and let's consider the ways that we've been raised to be respectful of one another. And that goes for when you're in the community, in the public, and I believe also when you're online. There's going to be a lot of communication that's going to keep coming out. We're going to keep learning new things every day. So let's work together to foster a positive outcome to the best of our abilities. Last thing today, just want to celebrate the outdoors. You know, if there's one good thing that I take away from this past 8 weeks is I have seen more people outside enjoying this beautiful Four Corners weather, being able to go to the lake, go to the trails, just walking your neighborhoods. I've seen so many folks walking neighborhoods, and I just want to say thank you for that. I think eventually when we get to this point, there's going to be opportunities for entrepreneurs to take advantage of the demand for outdoor recreation services and goods. And so I still want to continue to talk about the Outdoor Recreation Industry Initiative and ways that we can capitalize on that now as we're seeing more people going out and doing new things that maybe they weren't doing before and leading a healthy lifestyle. So happy Mother's Day, moms. Thank you, Jack and Jeff, for letting me join you for this update. And let's just keep pushing forward. Thanks.
Thank you, Nate. Thank you for joining us. Jeff, thank you for joining us. I'd like to remind you of something that Jeff said today, that you were the most contagious the days prior to having COVID symptoms. We're averaging 200 positive cases a week. So the two things I want to remind you is, one, it's Nurses Week. Be praying for our nurses and be praying for our healthcare workers. The second thing I want to remind you is that yesterday was the National Day of Prayer. But for us in Farmington and San Juan County and New Mexico, and really our nation, we need to think of things as not a National Day of Prayer, not a National Week of Prayer, but perhaps a National Month of Prayer. When nothing else works, many people turn to prayer. Those of you who are prayer warriors, we need you praying for wisdom, for our leaders, for our president. You need to be praying for protection for those who are working in the hospital situation. And so that's our plea to you today, to stay safe, pray for our nation, pray for our people, pray for our Farmington leaders, San Juan County. Keep your mask on. Until the next time, I'm Jack Fortner, Chairman of the San Juan County Commission. Appreciate you joining us.